the first one I will want to tell you is the basal tornado. This is the smooth surface, fully threaded implant, right? So what we can do is these are for those situations in which the opposing penetration cannot, the opposing cortex cannot be penetrated and cannot be breached with our drill. Okay, we cannot perforate the opposing cortex, but this is a very important point. The implant apex can be rested on the basal cortex without actively engaging it. We can see in this radiograph I have placed this implant. So what I have done is, because the patient has sinus issues, right? So if I tried to go for the basal cortical screw, there might be the trouble of infection of the implant because of the sinusitis issue, the sinus infection. So in this case I will be using a smooth surface compressive implant, and what I have done is I have rested the apex of the implant on the floor of the maxillary sinus, right? We can appreciate this. And there is also certain cases, even if we are not able to rest the apex of the implant on the secondary cortex, in that case we have a basal pros design. Basal pros is similar to the basal tornado. The only difference is that this is a smooth surface design, and in this case the surface of the threaded portion has been treated with SLA treatment. Okay, what we have been done, we have sandblasted the surface and then the acid at the surface, like we do in the conventional implantology. This is the exception. This implant, the surface treated implant, is an exception to the established norm of the surface characteristics in basal implantology, but it does not violate the principles of traumatology, because such kind of implant, the surface treated implants, are used in the polyaxial screw that we are using in the treatment of spinal fractures. The polyaxial screws, that the perforation of the secondary cortex is not at all desirable, right? Because there are certain vessels and nerves present on the medial side. Okay, and then what happens is the engagement of the implant second cortex is not at all possible. So this is why they also use a surface treated design. The application, practical application, I will show you in this slide. We can see, because the nerve was there, right, and because enough vertical bone height was present, I chose not to engage the lingual cortex. What I have is done, I have placed a surface treated basal implant in these areas. So the mandibular area is a very good example of usage of the surface treated basal implants, right?